Hi everyone, I am Beatrice. In this video, I will break down liver cirrhosis or cirrhosis of the liver. We will look at the pathophysiology of this disease, the signs and symptoms, how it is diagnosed, and how to manage the condition. So let's begin. Liver cirrhosis refers to the chronic, irreversible destruction and replacement of healthy liver cells, the hepatocyte, by scar tissues. The major cause of liver cirrhosis is alcohol abuse, years and years of alcohol abuse. Other causes include chronic viral hepatitis like hepatitis B, C, and D. There are also non-alcoholic fatty liver disease where there is accumulation of fat in the liver, especially in condition where the patient is obese, like in obesity, in diabetes mellitus, in metabolic syndrome. They could develop this condition. There's also autoimmune disease where the body is beginning to fight itself. It can also develop when this patient has heart problem, especially right-sided heart failure. Over time, it could affect the liver. Now, also, there's biliary duct disease. Any disease that affects the bile duct. Remember, the liver produces bile. Any obstruction in that bile duct where the bile is not able to flow out and it begin to circulate in the liver, it will begin to destroy the hepatocyte, those liver cells, and replace it with scar tissues. Now, before we look at the pathophysiology of liver cirrhosis, I want us to first look at the function of the liver because the liver does a lot of function. So that when we look at the signs and symptoms, we will understand why the patient feels that way. The function of the liver can be divided into metabolism, storage, and production. But I've broken it down into what I call the ABCDs function of the liver. The D is raised to power 2, the S is raised to power 2. The A stands for albumin production. Albumin is a protein. It's found in the plasma. It helps to maintain oncotic pressure. It keeps fluid inside so that it doesn't leak into the interstitial spaces and cause edema. Also, albumin helps in transport of drugs and it helps to bind with calcium. So a patient that have low albumin may suffer hypocalcemia. The B stands for bile production. Now, this bile, when produced by the liver, it helps to remove bilirubin, and it also helps to remove high cholesterol in the body and helps in fat metabolism. The C stands for clotting factors. So the liver produces some clotting factors, and one of the D stands for drug metabolism. The other D stands for detoxification of ammonia. Ammonia is a byproduct of protein metabolism. If it is much in the body, it can be toxic. So the liver helps in breaking down this ammonia into urea so that it can be excreted by the kidney. One of the S stands for storage of vitamins, the fast soluble vitamins, vitamin A, D, E, and K. The last S stands for storage of glycogen. So if you remember, when you eat, excess glucose is stored as glycogen in the liver, meaning if the liver is not functioning well, there may not be storage of glucose, and that can lead to hyperglycemia and diabetes. So the pathophysiology of this disease begins with liver injury and inflammation. Any of those causes we have mentioned can lead to liver injury, and as the liver is injured, it causes inflammation because the body, the immune system, will want to fight, want to see how they can solve it. They cover cells, they are macrophages. They want to kind of see how they can fix the problem. But as they try to do that, it will not solve it. It will lead to fibrosis or scarring. So those healthy liver cells will begin to get hardened. And that's due to deposit of collagen. So the more the collagen are deposited, it becomes hardened and very strong to a point that the liver, there will be no more flow, proper flow. The liver cells will want to try to regenerate itself to kind of see if they can get a fresh new cells of the liver. But as they try to do that, nodules are formed instead. These nodules will worsen the scarring, leading to bile and blood flow obstruction or blockage. And with this, if it continue, there's going to be pressure within the liver. So there will be no proper flow, and that will lead to portal hypertension. And if it continues, the liver eventually fail to perform its function. So the patient is going to start manifesting some signs and symptoms. The early signs and symptoms will be fatigue and weakness. The patient will be complaining of constantly getting tired, and they will lose appetite, anorexia, loss of appetite. They will be feeling sick, just kind of nausea, and then vomiting. They will be throwing up. They may have mild abdominal discomfort, especially at the right upper quadrant. And then they could experience weight loss and passing flatus more than usual, and they may experience pruritus, and that could be as a result of increased bilirubin that's also flowing in the body, because the liver is not able to remove it. So it begins to flow and can lead to that pruritus, itching of the skin. And then, of course, jaundice, that is also linked to that bilirubin that is not being removed by the body. Now, other things, the patient will experience hematological problems, some blood issues like anemia, thrombocytopenia, leukopenia. And that's because of those clotting factors are no longer able to do the work. The immune system is not functioning properly anymore. Endocrine issues like estrogen production will be affected. The patient may be experiencing some menstrual irregularities. There could be testicular atrophy, and edema and ascites will develop over time because of that albumin that is no longer being produced to help maintain oncotic pressure. Easy bruising, that's because of that problem with clotting factors production. And infection, of course, with leukopenia, there will be infection, tremor, and asterixis, where there will be hand flapping, and added deficiency. So the vitamin A, D, E, and K will be deficient. And then the patient will manifest things like splenomegaly. The spleen becomes enlarged. That is due to that increased portal hypertension. Because of the linkage between the spleen, the liver, that's connection. It will make the spleen to get bigger, and even the liver itself, because of those flow that is obstructed, will get bigger, what we call hepatomegaly. There are other symptoms that also manifest. To diagnose liver cirrhosis, they could do clinical assessment, they take history, physical examination. When you palpate the liver, it's going to look so enlarged. And those signs and symptoms, the patient is going to give you some of those signs and it's going to tell you how they feel. The laboratory test, they do some liver function tests. There will be elevated liver enzymes like AST and ALT. Even bilirubin is going to be high. Bilirubin is a byproduct of red blood cell breakdown. But when the liver is not able to properly remove it from the body, then the bilirubin is going to be high. Ammonia too will be high because the liver will not be able to detoxify the ammonia. Ultrasound, CT, and MRI can show the enlargement of liver. It could also, especially the CT and MRI, it could detect that fibrosis, that scarring of the liver cells and nodules. Liver biopsy, when they do liver biopsy, it can confirm the fibrosis and liver cirrhosis. Treatment and management. So to manage liver cirrhosis, you're going to be assessing their mental status. Because of that high ammonia, if it gets so high, it can affect their neurons. So they may be even in coma. So you want to be checking their reflexes. You want to check how alert and oriented they are, and to be ensured that that ammonia is not high. Diet, so they should be on low sodium and low protein. The reason why they should be on low sodium and low protein, the reason why they should be on low sodium is because sodium can lead to further accumulation of fluid, which is edema. And the low protein is necessary because protein, the byproduct of protein is ammonia. So if you give them more protein, you are going to cause more problem with ammonia because the liver is not functioning well to detoxify it. You monitor their weight, you measure their abdominal gait, especially when they're having ascites. Reposition them every 2 hours because now they are at risk of infection, they can develop skin breakdown, and also put them in upright position so that they can breathe well. Because that at that time the liver is enlarged, the spleen is enlarged, the abdomen, there's ascites fluid in the abdomen, they may not be able to breathe properly. But when you place them in upright position, it helps. Infection prevention, because at this point they are already going through problem with leukopenia, they are not able to fight infection. So you want to, as much as possible, reduce exposure to infection. Assess bleeding because they will bruise easily. So you want to assess bleeding because those clotting factors are no longer there. Give them soft toothbrush so that they will not bleed. Now, after injection, try and apply pressure on the site for at least 5 minutes because you know they bleed easily. Now, decrease activities because they're going to get tired, and because of that loss of appetite, they're not eating well. So you don't want them to exhaust all their energy. Lactulose, this is very important. You're going to give them robust lactulose as prescribed. So because lactulose is going to help in the removal of that ammonia. Because if that ammonia is so much, it can go to the brain and cause coma. It can cause what we call hepatic encephalopathy. And when it gets to that place, it becomes an emergency. So when you give them lactulose, it helps to remove that excess ammonia from their body. PO vitamin, because they're already lacking in those vitamins, fast soluble vitamins. So you want to give prescribed PO vitamins. No alcohol. Remember, a major cause of this condition is years of alcohol abuse. So no more alcohol, no raw seafood, because they're at risk of infection. So you want to limit infection. Fluid restriction as prescribed, because of course they're going to prescribe limited fluid because the patient is already retaining a lot of fluids. Now, the complication of this condition can be esophageal varices, even liver cancer. So that wraps up today's topic on liver cirrhosis. If you find this video helpful, please like, share, and subscribe for more educational videos. Thanks for watching.